Good morning, everyone. Let me introduce my name. I am Dennis Ivan Omipon from the Bataan Peninsula State University, Orani campus. Your one and only moderator for this exciting roundtable discussion about the current issues and trends in our world. I'm happy to see that representatives for this activity are all excellent professionals and well experienced. By this day, knowledge will rise up and comes to every professionals based on their ideas, perspective, point of view, and of course, experience by the causes of these current issues. This topic is all about the mental health condition caused by the COVID-19 pandemic. Public health emergencies are evident in the current scenario of COVID-19 pandemic. In this situation, many were caught not ready, even professionals and people who are experts in epidemics and disaster management. With these arising issues and challenges, mental health become at stake and violence are dominating in every corner of barangay and even at home. That's why you all here, dear professional, to make a best holistic possible answer to those questions that related to our topic. But before we start, here are some reminders, guidelines, and rules while you are all inside the meeting discussion. The first is wear appropriate clothes. Make sure you look presentable. Second, this meeting are being recorded. Keep your microphone mute if there is someone was speaking. Remove any distractions to interrupt others. Raise your hand if you want to say something or ask something. 6. Only fact and not false statement are considered to this online roundtable meeting. If there is no question, let's begin by introducing our representative. First is our legal professional. Please introduce yourself, sir.
Hey, sir. Hey, sir. I'm Renz Nazareno from legal sector.
Thank you. Second is our educational professional.
I'm Aeron Tayag, representing education.
Thank you, sir. Third is our professional practitioner.
Hello, I'm Charles Vincent David, representing practitioner.
The last is the global and international professional.
Hello, good afternoon. I'm from the sector of international and global, Renz Tala.
Okay, thank you. Are you ready, professionals? Okay, let's start the meeting to the first question.
Yes.
Here are the first question. What are the common observations, practices, causes, and risk factors of mental health challenges and issues amidst COVID-19 among Bataeños? The first professional that will answer this is Sir Arvi Nazareno.
Good day again. The COVID-19 pandemic is a major health crisis affecting several nations. Such wilderness outbreaks are associated with adverse mental health consequences, psychological distress, and symptoms of mental illness. Psychiatrists across the world should be aware of this manifestation, their correlates, and strategies to manage them that encompass both the needs of a specific population, especially in Bataan. In public mental health terms, the main psychological impact to date is elevated rates of stress or anxiety. But as new measures and impact are introduced, especially quarantine and its effect on many people, usually activities, routines, livelihood, develop loneliness, depression, harmful alcohol and drug use, and self-harm or suicidal behavior are also expected to rise. Public health actions such as social distancing are necessary to reduce the spread of COVID-19 pandemic, but they can make us feel isolated and lonely and can increase stress and anxiety. Learning to cope with stress in healthy way will make you, the people who care about you, and those around you become more resilient. Thank you.
Okay, thank you, Mr. Arvi. Next is Mr. Tayag.
Education. In order for us to study and teach well, mental health performing a big factor in our side. We cannot deny the fact that online class is more stressful than the face-to-face one. And at the same time, the face-to-face classes have been more effective than the online class learning. Under such condition, many tend to be less physically active and have a longer screen time, irregular sleep patterns, as well as worse diets, resulting in waned gait and lost physical fitness. Low-income families are especially vulnerable to negative effects of stay at home rules as they tend to have a substandard accommodation and more confined spaces, making it difficult to engage in physical exercise, though we should still be doing some safe sports and exercises for us to stay fit and healthy during this pandemic. The benefits of exercise are proven very helpful, especially nowadays in this pandemic. And as a students, we really need to be physically healthy for us to be enabled to stay stay focused on our school, especially in times of anxiety, crisis, and fear. And for us to be able to be mentally healthy, we must keep pushing ourselves into the limit. Thank you.
Thank you, Mr. Tayag. The third one is our professional practitioner, Mr. Charles Vincent David.
Pagka ganun ba, Kuya Tagul, medyo mahirap na disciplinahin pagka medyo mas malaki.
Good day. I'm pleased to have the opportunity today to speak with you about COVID-19. In responding to this public health emergency and the continuing challenges the agency and the medical profession face as it continues to evolve, I'd like to begin by thanking all of the professionals here associating for hosting and moderating this event today, as well as for their continuing support. And I'd like to thank all of the physicians and healthcare professionals on this call for today for your hard work, thoughtfulness, and commitment during this time. Among the heroes who have emerged from this crisis are the healthcare professionals who have risked their own health to serve their patients. As we move forward, we know the pandemic continues to evolve and the healthcare community must continue to deliver high quality care to all of patients. Thank you.
Thank you, Mr. David. The last one is Mr. Renz, our international and global professional.
Okay, good afternoon. In the global and international methods, the COVID-19 cases reported between December 31, 2019 and, and June 10, 2021 were identified daily from official website, press release, press conference, and social media feeds of our health government. Case characteristic, travel history, and exposure to other cases were abstracted. My findings. Among the first case reported from each of the affected countries outside of mainland China, 76% had recent travel to affected countries. 61% had traveled to China, Italy, or Iran. The median age was 51 years old and the younger age was 18 years old. 1,200 cases in healthcare workers. Okay, thank you.
Thank you, Mr. Tala. It was very intense hearing all ideas and statement based on every professional like all of you. To further continue the meeting, let's go now to the next question. Question number 2 is, what are the regulating and statutory policies and guidelines that examine social and economical determinants of mental health conditions of Bataeños? Let's start also again to Mr. Arvi Nazareno.
Okay. Social determinant of mental health was selected in order to enhance our knowledge about the many interacting forces that between them shape individuals and collective levels of mental health and well-being, and set out action that can be pursued to promote the protect good mental health. Bataan LGUs provide a coherent framework that employs a life course approach for assessing the social determinant of mental health. Taking a life course perspective usefully demonstrate how risk exposures in the formative stage of life can affect mental well-being or predispose towards mental disorder many years or even decades later during this time of pandemic. Thank you.
Okay, thank you. Let's hear also the idea of our uh, professional in education, Mr. Aaron.
Education. Why does mental health matter in school? Addressing mental health needs in school is critically important because 1 in 5 children and youth have diagnosed emotional, behavior, or mental health disorder. In 1 out of 10 young people have mental health change that in severe enough to impair how they function at home, school, or in the community. One of the problems that families frequently run into getting into the school to recognize and the role of mental health disorder in relationship to the difficulty their child is having. Getting agreement to put these strategies in place to address mental health issues of the children. Many countries have decided to close school, colleges, and universities because of the crisis. The, the crisis facing closing schools to reduce contact and saving lives, but the learning is keep the government decided to make a blended learning or online learning at home. School is not a massive shock to parents' productivity, but also to a children's social life and learning. Student assessment are also moving online with a lot of trial and errors and uncertainty for everyone. Many assessments have simply been cancelled. Importantly, this interruption will not just be a short-term issue, but can also have a long-term consequences for the affected cohort and are likely to increase inequality with this COVID-19 pandemic health crisis. Thank you.
Okay, very well said, Mr. Tayag. Uh, let's hear about the opinion of our professional practitioner, Mr. David.
Hello again. Fortunately, we've made significant progress in our understanding of this disease, our ability to combat it, and our efforts to help patients suffering with it. As healthcare professional, we understand there are no easy answers. We still have much more to learn about this disease, with many unanswered questions, and we need to not only treat patients with the disease, but also to prevent the spread of this disease as we seek effective therapeutics and safe and effective vaccines. Thank you.
Thank you, Mr. David. Last but not the least, our global and international professional, Mr. Tala.
Okay, good afternoon again. In the international sectors, the World Health Organization has updated operational planning guidelines in balancing the demand of responding directly health service delivery and mitigating the risk of the system collapse. Countries should identify essential service that will be prioritized in their efforts to maintain continually of service delivery to ensure that increasing limited resources provide maximum benefits for the population. They also need to comply with the highest standard in precautions, especially in hygiene practices, and the provision of adequate supplies, including personal protective equipments. Some example of essential service includes routine vaccination, reproductive health service, pregnancy of the child, management of emergency health condition, and others. The guidelines stress the importance of keeping up-to-date information. This requires prevent transparent communication with the public security meet with essential needs to control infection risk and health facilities. Okay, thank you.
Thank you all dear professionals for your knowledgeable answers for the question number 2. Now let's proceed to the question number 3. Here are the question. What platforms, best practice, or interventions mechanism to identify health and socio-economic consequences? Let's also start with Mr. Nazareno.
Pardon, Mr. Moderator, can you repeat your question?
Okay. What platforms, best practice, or intervention mechanisms to identify health and socio-economic consequences?
Okay, thank you. Within a short term, within a short time, the COVID-19 pandemic spread throughout the Bataenos, becoming a true pandemic that has several affected almost every country. The COVID pandemic has direct impact on mental health, along with its impact on public health. The pandemic has also affected the operation of supply chains, sustainable economic growth, and the environment performance of supply chains. There are several strands of research on business disruption and its management in the context of the food and beverage industry. Some of the latest study have investigates the impact of COVID-19 pandemic of food supply chain, but have not considered the strategies to overcome the negative impact of the pandemic. That's all. Thank you.
Thank you, Mr. Nazareno. Also followed by Mr. Tayag, our professional in education.
Can you repeat the question, Sir Dennis?
Okay. What platforms, best practice, or intervention mechanisms to identify health and socioeconomic consequences?
Thank you. Education has important social impacts on health. In reviewing the evidence, the education does not act on the health isolation from other factors. Income is another very important factor that interacts in many important ways with education as influences on health. This makes it hard to assess their independence effects. However, investigation often find that the effects of education health is the least as great as effect of income. Those who with more years of schooling tend to have a better health and well-being and healthier behavior. Education is an important mechanism for enhancing the health and well-being of individual because it is reduce the need for healthcare, associated costs of dependence, lost earning, and human suffering. It also helps promote sus- sustain healthy lifestyle and positive choices, supporting nurturing human development and human relationship and personal family community well-being. The lockdown of education institution is going to cause major interruption in students, learning disruptions in internal assessment, and the cancellation of public assessment for the qualification of the replacement by an inferior alternative. What can be done to mitigate those negative impacts? Schools need resources to build loss in learning once they open again. How these resources are used to get to children was especially hard hit in this question. Given the evidence of importance assessment for learning, school should also consider postponing rather than skipping internal assessment. For new graduate policies should support their entry labor market to avoid longer employment period. Thank you.
Thank you, Mr. Tayag. Now let's hear about the insights of our practitioner, Mr. David.
Hello again. Today, I want to talk to you about some of these challenges and about the nature and importance of science and data as we search for answers. I also want to speak with you in your role as professionals who are dealing with very practical questions involving patients and experience. I understand and emphasize with from my own practice as an practitioner. Thank you.
Thank you, Mr. David. Uh, our last professional will answer the question number 3 is Mr. Tala.
Oy, good afternoon. In the international and global sectors, the lockdown, curfews, self-isolation, social distancing, and quarantine had affected the overall physical, mental, spiritual, social well-being of the countries. Although these measures are taken for the protection of people from COVID-19, it has created fear, anxiety, which needs to be addressed immediately. Strengthening the healthcare workforce, conducting mandatory health education and training in school, health manpower, investing and expanding the scope of health research, and establishing well-equipped laboratories. The long-term battle with coronavirus may help people to win against it by developing vaccines and medicines. However, in the country must prepared for numerous mental health threats associated with the pandemic and action should be established and implemented. Thank you.
Okay, thank you, dear professionals, for your all informative knowledge that answers. Now, for our last and final question, let's start now to the question number 4. Are you ready? Okay. Share or present purpose and explain holistic and integrative approaches to prevent in national and global scale. Again, share and present, propose and explain holistic and integrative approaches to prevent in national and global scale. Begin with our legal professional, Mr. Nazareno.
From legal sectors, the pandemic has reminded us bluntly of the fragility of some of the most basic human-made systems. Shortage of masks, tests, ventilators, and other essential items has left frontline workers and the general population dangerously exposed to the disease itself. At a wider level, we have witnessed the cascading collapse of entire financial, and transportation system due to a vicious combination of supply and demand. At the moment, Bataan LGU.
Okay,
Can I continue now?
okay, sorry.
Bataan LGUs are struggling to absorb the shock generated by the pandemic, but in the international community will overcome the crisis and begin the recovery phase. The Bataeños' response to help them in this process has been twofold: address immediate concerns and propose an approach to dealing with the longer-term issues the pandemic highlights. In the short term, that means identifying the people and activities most affected, assessing how measures to help them will impact others, and underlining the difficult trade-off between health, economic, social, mental, and other goals are inevitable. In the longer term, an approach that reacts to the systematic origins and impact of major shocks is needed to policies are into affected. Thank you.
Okay, thank you, Mr. Nazareno. Next is our educational professional, Sir Tayag again.
Thank you, Sir Dennis. Education. Going to school is the best policy tool available to raise skill. While school time can be fun and can raise social skills, and social awareness. From an economic point of view, the primary point of being in the school is the increase of child's ability. Even a relatively short of time in school does this. Even a short relatively short period of time missed school will have consequences for skill growth of students. But can we estimate how much COVID-19 interrupt will affect the learning of students? No. We should all staying positive during the COVID-19 pandemic. Do know that this will not be stay forever. This is a difficult time in school and also for us. But in this time, we should remind ourselves that what is good in life, some circumstances right now may be hard to change or contribute to your feelings helpless. But there are things in life that are good, inspired gratitude. Making a list of good things that you have appreciate, large or small, can shift your focus in a positive direction. And when the time is right and everything will be back to normal, we can all call ourselves successful because we survive in this pandemic and keep the learning on the process with this crisis. Thank you, Sir Dennis.
Thank you again, Sir Tayag. Our third one is our practitioner, professional, Sir David.
Hello again. We as medical practitioners not only understand this commitment, but also that you reassure your patients. We have seen surveys reporting that significant percentages of the public would be reluctant to take a vaccine. We hope that you will urge your patients to take an approved vaccine so that we can seek to establish widespread immunity. We can emerge from this emergency only by working together. We know that the overwhelming quantities of COVID-19 information and data that seem continually to be expanding can place a significant burden. As clinicians seeking to respond to patient questions and when appropriate modify treatment and recommendations. Indeed, COVID-19 is affecting the practice of medicine in many ways, has an important role to play in supporting providers and patients through this evolution. Thank you.
Thank you again, Sir David. And also our last professional, Sir Tala.
Okay. In the international and global sectors, success in dealing with the epidemic depends on the combination of socioeconomic and political factors that include the state of health system before the outbreak, social norms, and rapidly and intensity policy responses such as lockdown and testing. In Korea, combines a number of characteristics that appear to favor an affected response. For example, a tradition of wearing a face mask to prevent spreading colds and other disease. Korean government uses mobile device to support early testing and contact tracing. Advanced ICT were particularly useful in spreading emergency information on novel virus and help maintain extensive social distancing. In Germany, government attitudes some of success to its national pandemic preparedness. Okay, thank you.
Thank you all professional personnels. We also appreciate all your ideas, opinions, and sharing experience based on what you've all encountered during to the first scenario and until now by this pandemic with which is the COVID-19 pandemic. Hope that all of your knowledge that shared with us will give others an ideas and additional point of view that they can use their daily life again. Thank you, sir. To end this activity, dear professionals, please share your own different advocacy or educational campaign promoting mental health and preventing violence. Let's start again to Mr. Arvi Nazareno. And also, additional, please provide your own hashtag about your that represent your advocacy. Again, Mr. Nazareno.
Okay, second. This is my hashtag. Keep your mindset. And my advocacy is maintain good relationship with people for good mental health. Thank you.
Thank you, Mr. Nazareno. Our next is Mr. Tayag.
My my advocacy hashtag is Ed Leadership.
Okay, thank you,
So
Mr.
yun.
Tayag. Thank you. Uh, our third is Mr. David.
Hashtag is stop the COVID. As the world moves towards the next phase of the COVID-19 pandemic response, equitable access to vaccines and treatments will be vital to saving the life of the most vulnerable people, those living in humanitarian emergencies or in settings that are not under the control of national governments are at risk of being left behind and must be part of COVID-19 vaccination efforts, including all individuals regardless of legal status in national allocation plans in critical, particularly in settings characterized. Sorry.
Okay, thank you, Mr. David.
Hello.
Our oh yes, Mr. David.
Hello. Hello, sorry. Can
Okay,
I
Mr.
continue?
Yes, you can proceed, Mr. David.
Okay, sorry for an interruption. Um, in national allocation plans, plan in national allocation plans is critical.
Okay. Uh, Now let's hear about the advocacy of Mr. Tala.
Okay, my hashtag is stay safe. Stay safe. My advocacy is to stop the spread of germs, prevent the spread of respiratory disease like COVID-19. Avoid close contact with people who are sick. Cover your cough or sneeze with tissue. Co- Avoid touching your eyes, nose, and mouth. Clean and disinfect your touch object. And wash your hands with soap and water at least 20 seconds. Stay safe, guys. Thank you.
Thank you, Mr. Renz. I also provide my own hashtag, which is Fit for Life, and represent this by encouraging all people to make a physical fitness depressions. Ayan, to prevent the depressions and the stress by making an indoor game with your family and friends. Thank you. Thank you all professionals and to all your support and knowledgeable answers to those questions about our current trends in the world. Yeah. Thank you and God bless.
Thank you, sir.
Thank you,
Thank you.
Sir Dennis.
Thank you. Thank you.
Thank you.